Great. So first I want to introduce Carolyn or Carrie Olson. She's Assistant Commissioner of the Bureau of Environmental Surveillance and Policy at the New York City Department of Health and Mental Hygiene. This bureau's multidisciplinary team of researchers, data scientists, and lawyers works to influence environmental health policies and programs through innovative health surveillance, legislative, and regulatory action, and informatics across topics ranging from air quality and climate change to childcare and restaurant regulation. Carrie and her team have been leading multifaceted efforts to combat the health impacts of extreme heat via healthcare system investment, community resiliency, and equitable access to air conditioning. Building on 15 years as a department, Carrie has focused her expertise on the effective use of health data to inform public health practice through collaboration with academic, community, and government partners. She received an MPH from Columbia University Mailman School of Public Health and a BS in journalism from Northwestern University. So welcome, Carrie. Thanks for coming. And next, I would like to introduce Judy Sheridan Gonzalez. Judy is the president of a 40,000-member New York State Nurses Association, New York's largest nurses union. She's worked more than 30 years as an emergency room RN in Montefiore Hospital in the Bronx, as well as in a variety of other specialties in assorted healthcare environments. She is part of an active group of nurses engaged in transforming the organization into a social justice union, pledged to participate in uniting labor and community in order to construct a movement dedicated to combat inequality and committed to social change. So thank you, Judy, for joining us. Next, we have Janie K. Bavishi. Janie serves as a director of New York City Mayor's Office of Resiliency, where she tackles the challenge of climate change through science-based analysis, policy, program development, and capacity building. She previously served as the Associate Director for Climate Preparedness at the White House Council on Environmental Quality under President Barack Obama. Bavishi has a master's degree in city planning from the Massachusetts Institute of Technology and a bachelor's degree in public policy and cultural anthropology from Duke University. So welcome, Janie. Last but very certainly not least, we have Tanya Jones. Tanya has worked at HeartShare Human Services for over 20 years and is the Director of Energy Assistance and Community Development. Her position entails developing low-income assistance programs for utilities and other entities, while currently managing multiple grant programs which serve New York State's low-income population throughout the year. She also works closely with New York State elected officials' offices, community-based organizations, major utilities, New York State Public Service Commission, nuclear companies, and the general public. Her efforts also include being strongly active in community outreach, implementing new community initiatives, presenting on low-income issues and programs, energy efficiency and policies on state and national level, and is a strong advocate of low-income, elderly, and disability issues. In addition, Tanya serves on the board of several advisory committees for New York State and the National Board on Energy and Utility Affordability. She is also a national conference planner and a private event planner. So thank you very much for coming, Tanya.
Introducing all these people. I don't want to know their credentials and who they are.
So let's make sure we mute everyone's microphones. Thank you. So we'll bring up our first speaker. Each one of our panelists are going to present about 3 minutes about extreme heat for you all. And the first we'll have is Carrie. Take it away.
Great. Good morning, everyone. And thank you so much to Sonal and the WEAC team for having me here today to talk about what is an incredibly important topic to me and to us at the Health Department. And it's a very appropriate day because it's very hot. I think we're going to be nearing heat advisory heat levels in the city this weekend. So I'm honored to start us off with a very quick discussion of and context about why at the Health Department we care about heat and how it relates to public health. So hot weather is more than just uncomfortable, it actually can be deadly. And in New York City, every year on average, we see about 13 people who die from heat stroke each year, and another 115 who die from a pre-existing health condition that was worsened by the heat. We also have more than 600 ED and hospitalizations related to hot weather each year. And all of that is without an ongoing pandemic with keeping people at home. So the health department conducts research and surveillance on heat-related illness and death. And what we know is that most heat stroke deaths happen after exposure to heat inside a home without a functioning air conditioner. In addition to not having AC at home to keep you cool, those who are most vulnerable have one or more risk factors, which include older age, people with chronic health conditions such as renal disease, respiratory disease, obesity, people with serious mental illness, people who use drugs or alcohol, and people who take certain medications that may make it difficult for them to, their bodies to regulate their temperature. So we know also that the same populations that are at risk of severe COVID-19 complications are also at risk of heat-related illness if they don't have an air conditioner at home. And this is the reason that this summer in particular, even more than others, we're focused on in-home cooling assistance. Access to air conditioning and the health impacts that come from not having access is an issue of health equity. We know that the risk of death during a heat wave is higher among non-Latinx Black New Yorkers, and it's most common in our poorest communities. And these inequities in heat-related death mirror those that we've been seeing in COVID-19 severe outcomes and so many other health outcomes. And they stem from the racist systems and policies that have impacted opportunities and resources in our communities. This has a direct impact on many household decisions, including the ability to afford and use air conditioning. And I want to make clear that not only are there many who don't have air conditioning, but there are also many who are suffering from energy insecurity and don't have the dollars to turn that on. We know that 12% of adults who are 65 years and older report not having an air conditioner citywide, and it's 22% of adults, older adults in East Harlem. So there are huge disparities in our city on this. And this summer, COVID-19 is keeping us all at home way more than usual, particularly people who are at greatest risk. And that's why checking on our neighbors, our friends, and family before, during, and after summer heat waves is such an important measure to be doing right now. I want to mention quickly that you can get lots of information on health and heat, as well as tips to stay safe yourself and also help the people that you care about at nyc.gov/health/heat. And I'll stick that into the chat. And I'm really happy and look forward to answering questions, but I'm going to pass the mic now to my colleagues to talk more about climate change and the work that we're doing to make our city a resilient and sustainable one. Thanks so much.
Thank you, Carrie, so much. And quickly before I pass it off to Judy, who will be our next speaker, I forgot to mention that I know Marquis said we'll mention the raise hand function for asking a question, but for this panel today, we're actually asking you to drop your questions in the chat so that we can compile them all. So if you have a question, please put it in the chat box, and we have someone that's going to kind of bring them all, put them all together, and then we'll try to ask as many as we can to our panelists. Thank you. So next, we'll bring up Judy.
Hi, everybody. Good morning. So, as we know, our planet's getting hotter, and the overwhelming climate change that results from it has serious consequences to our ecosystem, and of course, the living organisms like us who live here. And we're impacted in this in very direct and indirect ways. Next slide. The program today speaks to one aspect, extreme heat, and it offers palliative solutions to this situation. But significantly, extreme heat can be mitigated with a variety of treatments, all of whom are accessible to folks with wealth and access to second home, central air, the ability to stay home, travel, and obtain other forms of relief. Next slide. But it's the poor and the working class, people of color, who always suffer the most and have the least access to such sources of relief. In the same way, the climate change that we see in our world today is promulgated by what we refer to as the global north and its indiscriminate use of fossil fuels. The deadly impact of these destructive practices is felt most of all by the global South, the vast majority of whom are people of color, indigenous peoples, and the poor, the marginalized, the colonized, and the oppressed. Next slide. But even in the North, next slide. Next slide. Even in the North, in the United States, and in New York City, where we live, the impact of this warming disproportionately affects a similar population, even one that lives in the industrialized world. And the impact occurs in all seasons, not just the summer. It's responsible for superstorms, for drought, for wildfires, for air pollution, and even for coastal blizzards. Next slide. So it's important to talk about the science very briefly. We've all heard of the greenhouse effect. Sun's radiated to the Earth and re-radiated back to the atmosphere and into space. However, man-made enhanced greenhouse effect, if you look at the slide on the right, that burning of fossil fuels such as oil, coal, and gas release dangerous gases, carbon dioxide, methane, nitrogen, even water vapor. And that prevents, you see that red, that prevents the heat from escaping, and that's what warms up the planet. Next slide. That warming causes glaciers, Arctic sea ice to melt. It changes the nature of the sea, the rising sea levels, and concentrating increased moisture into the air. And if you look at this slide, in 30 years, something that should take place over 200, 300 years, many centuries, half the Arctic sea ice melted. Next slide. And that's the cause of these superstorms such as Maria in Puerto Rico in 2017, Hurricane Sandy in New York in 2012, and even the storms of the last few days results in storm surge, flooding, and a lot of injuries and illnesses that result. Next slide. The diesel fuels, incinerators, and dumps with toxic gases concentrated in poor communities and communities of color permeate the air, stagnate as a result of increased heat, causing serious respiratory problems such as asthma and emphysema. And the map clearly shows where the problems are: the South Bronx, Harlem, East Harlem. They're the capitals of the nation. Next slide. Even more concerning, the resulting climate change from the change in temperatures create a perfect home for vectors, transmitters of disease, not just mosquitoes that carry viruses and bacteria such as Zika, chikungunya, and Ebola. Next slide. But as we see today, the new and more dangerous microorganisms such as COVID-19, which is the newest version of the coronavirus. Next slide. And the global pandemic that dominates our lives today. Next slide. The very direct health effects of heat, such as we see in New York City, particularly areas without foliage, concrete tall buildings, are heat exhaustion, as you heard, heat stroke, with symptoms that cause other problems such as rapid heart rates, confusion, exhaustion, weakness, and fainting. And these slides that we can make available to you, don't have to read them all. Cardiac complications, even heart attacks. Next. Lung problems due to the stagnant air and the changes in air pressure, forcing those with pre-existing conditions to have a much harder time breathing, even people with no prior issues. Next. Increases blood pressure due to the heat stress and mental stress. And mental stress and depression are a direct result of heat-related issues. And next slide. And these results can be deadly with metabolic changes and strokes. Next slide. All of these problems overwhelm our already crowded and understaffed emergency rooms, such as the one in which I work in the Bronx, forcing long waits, the inability of staff to properly care for patients. And with COVID, this is much worse. And as the summer progresses, if we get a surge, it's going to be a living hell. Next slide. So this is the point. Climate change is making us sick. Next slide. This is an excellent slide from the Centers for Disease Control that illustrates it clearly. You can download it, or perhaps we can copy it and make it available for you to study. It goes from the extreme heat, what it does to the environment, and how it affects your health. This is all factual. Next slide. So there isn't any time left to stop the burning of our planet. We have to take action. Next slide. And as the largest nurses union in New York, we now have 43,000 members. We in NYCHA are involved, as is WEACT, in fighting these fossil fuel corporations and their political supporters to move towards sustainable, publicly owned, and controlled energy to save our planet, our lives, final slide, and our future. Thank you. That's it.
Thank you very much, Judy, for that presentation of how heat is related to global warming and climate change. I stopped screen sharing just so we have more space to see each other now that we're not going to be using the presentations for a bit. And I want to welcome our next speaker, Jamie.
Thank you, Sonal, and thank you so much for having me, and thank you all for joining us for this important conversation on a Saturday morning. I just wanted to talk a little bit about what the city is doing to address extreme heat and the long-term impacts of extreme heat that Judy talked about, and then also what we're doing for this summer, given that it's an unprecedented season. So let me just start by saying that protecting New Yorkers from heat is a multi-agency effort. The Mayor's Office of Resiliency, which is the office that I lead, leads the city's long-term planning for climate change adaptation. New York City Emergency Management is responsible for emergency planning and immediate response when heat waves strike. And we work also with the Health Department, and especially Carrie, the Parks Department, the Department of Environmental Protection, the Department of Transportation, the Department of Small Business Services, and multiple other agencies. So this is really a multi-agency, multi-stakeholder effort within the city government. And there's no question that the challenges we face this summer are unprecedented. However, we already have a strong foundation for heat mitigation and heat resiliency due to the Cool Neighborhoods NYC strategy, which we released in 2017. And it's really an innovative strategy and a citywide strategy that's focused on tackling extreme heat and its cascading impacts. The strategy invested $106 million and laid out a comprehensive approach that will make neighborhoods cooler through significant tree plantings in city streets and parks, and painting reflective coatings on millions of square feet of rooftops in our most heat vulnerable neighborhoods. And then the strategy also laid out some ways that we can protect the most vulnerable New Yorkers inside their homes by providing heat risk education and increasing social support networks through our Be a Buddy pilot program, which WEACT has been an important partner in. And we've also enlisted home care agencies and community health organizations as partners in building community resiliency. So the strategy was designed with equity at its core. The city's heat vulnerability index, it doesn't only look at physical vulnerability, it also considers social vulnerability, including factors like poverty and race. And our investments are targeted at the areas that are identified by the HVI as facing the highest risks. But we know that COVID-19 and climate change are on a collision course this summer. We began planning for this heat season early on in the pandemic, knowing that this was going to be a very, very unique heat season. And the three pillars of our summer heat plan are more strategies to keep the most vulnerable cool and healthy without leaving their homes, utility assistance so that those who have air conditioners can afford to run them, and then adapted strategies to provide new cooling options outdoors and to make sure that cooling centers are safe. So the centerpiece of our summer heat plan is the Get Cool NYC program, which is providing over 74,000 air conditioners to vulnerable New Yorkers. And specifically, we are focusing on New Yorkers who are 60 years old or older and have income below 60% of the state median income and do not have air conditioning at home. So this program doesn't have an application component. Eligible New Yorkers are identified by NYCHA, by the Department for the Aging, by Human Resources Administration and the Department of Housing Preservation and Development, and city case managers are reaching out to them directly. It's an incredibly ambitious program. We've installed approximately 35,000 air conditioners so far, and we continue to reach hundreds of more New Yorkers every day. The second component of our summer heat program is utility assistance. So the city successfully petitioned the Public Service Commission to provide utility subsidies to 440,000 New York City low-income families. And they will receive about $140 from June to October for a total of about $70 million in aid. And this is incredibly important because, as I said before, it doesn't matter if you have an air conditioner if you can't afford to turn it on. So just wanted to make sure that, especially in the context of the economic crisis that we're facing now, that finances were not a barrier to keeping people cool inside their homes. But we also identified alternate cooling options for the summer. So New York City Emergency Management has identified alternate cooling centers from previous years that can be adapted to accommodate social distancing measures. And these are being operated under guidelines that have been developed in partnership with the Department of Health. And then we're also providing outdoor cooling options, combining our Cool Streets program with Open Street program, where parks, DEP, DOT will provide spray caps, spray showers, and will schedule hydrant openings to ensure access to outdoor cooling across the city. DEP has also created a reusable water bottle distribution program that began earlier this summer to promote reusable bottles and remind New Yorkers to stay hydrated. So why don't I stop there? I wanted to provide a quick overview of the work that we're doing this summer, and I'm happy to take questions.
Thank you, Janie, and thanks for highlighting all the work your office is doing with the city. And lastly, I would like to bring up Tanya.
Hi, everyone. Thank you for having me this morning. COVID-19 has definitely taken us all by storm, leaving us with a new way of life, or even somewhat a pause on life. I'm just going to give you a couple of national numbers. More than 40 million Americans have filed for unemployment during this COVID period. More than a quarter of those more than 1/4 of those, who have lost their jobs during this crisis have reported either skipping a bill payment or needing to skip a utility bill payment due to either food insecurity or fear of eviction. So those are really big things. Arrearages are piling up due to the moratoriums. People are just not able to pay, and they're not getting disconnected. So they're not really worried about it. They're worried about paying their other bills. Mainly, again, like I said, buying food for their families. All the children are home. Everyone has to worry about, feeding their kids nonstop. I personally have 2 kids. They eat every single hour of every single day. It's rough. So the projections with the surge in unemployment combined with the suspension of disconnections, the balances of unpaid bills are expected to reach $2.6 billion through 2022, which is astronomical. 9 out of 10 households have a person who is vulnerable to temperature extremes because of either age, disability, or some sort of health issue. These are the same people most vulnerable to serious complications from COVID. 1 out of 3 households are also reporting that they have gone without food in the past year. 1 out of 4 households can't afford cooling units, and this will stretch into the winter when it comes to the pandemic, because they are projecting those numbers into the winter. They don't see employment, gaining. They see more layoffs. At HeartShare, what we are seeing is people calling us saying, I don't want to turn on my air conditioner because I'm afraid that the air from outside is going to circulate inside and I'm going to get COVID. So there's a real fear there. They're also saying, I don't want to turn on my air conditioner because how am I going to pay this bill? Even though I'm not getting shut off now, I'm going to get shut off later. I can't afford to pay. We are urging people, if they have a unit, please turn it on. Utility companies are really, really lenient right now on giving payment agreements. We have kept all of our assistance programs open, so we are giving money to help with utilities right now. HEAP is open. HEAP is going to be open until August 31st. Everyone should be applying. There is a regular grant. There were 3 emergency grants. Please get your grants. There's also a fear of getting help. There's also a huge impact on people who are newly unemployed and the embarrassment of getting grants because they've never had to apply for anything. So now they're embarrassed. Like, I've never had to have this before. I don't know what to do. I don't want to get help. That's not me. We see a lot of that's not me. What we are doing is putting our information out there so that people can contact us directly if they need help. We can help them navigate through HEAP applications. We can help them navigate through payment agreements with utilities. Anything we can do just to help people through this time, because asthma patients, when they're running nebulizers, Con Ed doesn't really consider that life-sustaining equipment. However, we know if there's no electricity, you will not be breathing because you can't afford to run that nebulizer. Sometimes a pump is not enough. If you have an oxygen tank and your bill is astronomical and then the moratorium is over, you won't be able to run that oxygen tank. So it's a lot of information that's out there that people are just not getting, that we're just trying to make sure we distribute. There's a lot of reassurance that we're trying to do. There's a lot of just please go get your benefits. It's a really big push So if I will put our information in the chat box, the direct link to the energy department, if you know of people or if you yourself just need someone who can, you know, get their benefits or having problems getting their benefits or embarrassed of getting their benefits, if you know a neighbor who's just sitting there in the heat because they're afraid, please contact me. I will do the best I can to make sure they get everything they can, because this is a real extreme time. Thank you.
Thank you so much, Tanya, for that important information and connecting people to resources. Everyone, the HEAP app, there's a link for the application of the Home Energy Assistance Program in the chat box now. We'll also be sending all of these resources after the meeting as well. So before we begin some of our audience questions and our moderated questions, I want to bring up our member Gwen to ask her question. Gwen, take it away.
Thank you, Sonal. Good morning, everyone. My question is to the panelists. What plan?
Gwen, are you still there? You've cut out.
Yeah, it looks like she froze.
Seniors, as well as the home agency.
There she goes. All right.
Gwen, can you ask your question once more? You cut out
Sure.
a bit.
Okay, can you hear me?
Yes.
What plans, this is the panelists, what plans are in place to help our seniors as well as the homeless population who may be living on the streets get to cooling centers, especially in the event of an emergency?
Thank you, Gwen, and that's a question for any panelist. Thanks.
This is Carrie. I can start, but Janie, please jump in as well. So as Janie had mentioned, this summer during a heat event, the city will be activating the heat plan, which has been modified specifically to address the issues around COVID-19. There will be cooling centers available and promoted during a heat event, and those the Department of Emergency Management has worked very closely with all of the other partners, including the health department, to make sure that those are safe spaces where people can go to get relief from the heat. So I think that for those who do not have air conditioning, there will be options like that, as well as the cool streets and other outdoor options for people who are looking to just get some relief from the heat outside. So I think that's a start to the question, but if there's additional thoughts that the other panelists have, please.
No, I think that's right, Carrie. And the only thing I would add is that we have been targeting cooling centers and the outdoor cooling options in the most heat vulnerable areas across the city. So that's been kind of a lens that we've been using to ensure that options are available and without going a far distance.
Thank you both, and thanks, Gwen, for your question. We're running a little bit short on time, so we're going to kind of skip some of the pre-created questions that we had and center the audience's questions, if that's all right. So one of the first questions I want to ask is from the audience is one person is asking about the demographic breakdown of people who have deaths attributed to heat or maybe are hospitalized. So I'm wondering, is there kind of a racial inequality there? And also, how have we kind of seen racial inequalities play out in the summertime, generally with health issues related to heat?
Sure, so I can start that and then others please jump in as well. It's a great question and incredibly important, and actually has been a huge driver of a lot of our work at the health department. There are significant disparities, inequities in health, heat-related health outcomes. And those data are available online, and I encourage you to go check them out. I'll put, again, a link into the chat. But we do know that non-Hispanic Black New Yorkers have much higher risk of death due to heat in the summer compared to other New Yorkers. And when we look at a community level, Janie already mentioned the Heat Vulnerability Index, and this is an index that was put together by the health department with colleagues at Columbia that outlines the risk of extreme outcomes from heat based on social and environmental factors, and that includes poverty and race, as well as the actual temperature, which varies across the city, city by neighborhood, and greenery, so having a green neighborhood. And all of those things mean that we see much higher and more extreme risk for heat-related illness in certain neighborhoods in our city. And so, for example, East and Central Harlem, the index goes from 1 to 5, with 5 being the greatest risk, and East and Central Harlem are 4 and 5 neighborhoods. So there are inequities, and that's exactly what has driven a huge amount of the work that the city has done in order to address those and try to get support to the neighborhoods that are most in need.
I don't really have anything to add except to just say that, you know, heat vulnerability is a climate justice issue, and we recognize that. And that's why we have been taking social vulnerability into account to understand who's at risk, not just which areas are at risk, and making sure that the investments we're making and the solutions that we're advancing benefit those people, because we don't just want to know who's disproportionately impacted, but we want to make sure that the environmental benefits of the solutions that we're putting forward are also reaching those people who are the most impacted.
Thank you.
I would just add that when we were doing our research on COVID, there wasn't one statistical issue that didn't disproportionately affect people of color and Black people, not only in the city, but around the nation, not one, except for European-linked genetic abnormalities. That was the only area that wasn't disproportionately affecting people of color. So heat is definitely another factor. All what we call the social determinants of health disproportionately affect people who are poor and people of color. And this is part of the whole institutional racism that everybody's mobilizing around. It's violence as well. It's a killer.
Thanks, Judy, for adding that very important point. So the next question that we have is, we have a couple people asking, what are the signs of heat stroke? And I'll add to that, when should people know what is the point to seek healthcare for a heat-related illness?
So maybe I can start with that. So there's heat stroke and there's heat exhaustion, but some of the signs are, feeling hot, but something for a lot of seniors that you might not realize, because they tend not to complain, and their sensitivity to these mechanisms is not as strong as those with younger people, and you'll find confusion. That's a very, very early sign. People become a little bit out of it, a little bit confused, a little bit dazed. That might be the first thing you see in an older person, because their sensitivity to all kinds of other symptoms. Even another thing, it's not heat related, but it's important. One of the chief causes of death of elderly is sepsis, from urinary sepsis. They don't have symptoms of a urinary infection. They get confused. They may not have a fever. They get confused. Confusion in an elderly person is a critical issue that could lead to a lot of problems, but particularly with heat exhaustion and heat stroke. You might have tremors. You might start seeing kind of spots in front of your eyes, certainly weakness and dizziness, feeling very, very tired, nausea. Sometimes you'll get some gastric upset. You might vomit. You might feel like you have to go to the bathroom, an urge, or you have diarrhea. Your skin gets moist. You lose some color. And of course, heat stroke, your fever goes up very high, sometimes to a point where we can't lower it, even in the emergency room. And also your heart rate will speed up. You might want to check somebody's pulse. It shouldn't be higher than 80 or 90. If it goes over 100, that's another sign. Loss of appetite. When the skin goes from very moist and pale to very dry, that's a worse sign. That means that it's getting worse. We want to catch it early, and I assure you, confusion and being dazed is a very early sign that we should pay attention to. I'm sure my colleagues have stuff to add.
Great. I think it sounds like you covered it. Thank you, Judy.
Right. I was going to say, I definitely have seen seniors not complain, and that's one of the biggest things, that they will suffer all these issues and just say, oh, my you know, my heart is acting up, or, you know, I just have a headache, when really they're going through all these things and they don't want to say anything. And that's one of the biggest issues. They just don't say anything, and so you don't know. I really urge, you know, the community, especially, pay attention to the seniors, because they will be the first ones to, I hate to say it, the first ones to fall, because they're silent.
Thank you, Tanya. That's a very important point. So we're running a little bit short on time, so we're just going to ask 2 more questions, but what we'll try to do is get some of these questions answered after the fact and send them around to everyone. I don't want your questions to feel lost. But I'm going to try to ask some questions that put some of these in one. First of all, we have a couple people asking about power outages. So for the panelists, are there, you know, educational programs done to inform the public about using the AC appropriately, and are there considerations being taken for potential power outages?
I'm happy to start, and then my colleagues can add. So yes, we try to let people know that setting your air conditioner to 78 degrees is a way to keep cool and keep safe, but doesn't drive up your energy bill and doesn't put undue stress on the electrical grid. So we definitely work to get that message out. And absolutely, after last year's power outages, we've increased coordination with our utility providers, including monthly workshops and updates to our communication procedures. And then, given the context of the pandemic, we've actually doubled down on our engagement with utility providers. So both my team and the team at Emergency Management are on multiple weekly calls with the utilities, just to make sure we're monitoring and ensuring that there are no concerns or disruptions that we have to plan for, and that we can plan in advance and take action in advance in case there are any issues.
Just to add to that, if there is a blackout or a real power outage in your building, and you live in a tall building, you'll most likely lose water pressure. So we also recommend, particularly in the summer, for people to store water in gallon containers. You know, buy a bottle of distilled water and don't throw it out. Put some water in there. Get a Brita. They're not that expensive to have one on hand should you need the drinking water. And keep a couple of bottles of Gatorade handy. One of the reasons that people get very sick from heat is not just drinking water, but drinking water with electrolytes in it, so you don't throw off your metabolic system. So having Gatorade, or even making a concoction with a little bit of cranberry juice or apple juice and water in it. Drinking when you have a power outage, if you can afford a fan with battery run fan, we use those a lot in Puerto Rico when we had no power for months. That's also something that you can use. But drinking fluids is very helpful if you have no electricity at all, if there is a power outage. But we find the biggest problem is people don't store water, and drinking water is a very good solution to avoiding having heat stroke or heat exhaustion.
I would also just add to all of those great points that the utility companies also have particular programs where you can register if you need any sort of equipment for your health related to electricity, so that you, if they are seeing that there's any issues with power or a power outage happens, then you'll get services much more quickly. So we've done some campaigns to try to make sure that people are aware of these programs and that they register with the utility companies. But if you have any questions about that, you can call them directly, or you can reach out to the health department. We have information on our website as well. I think that's very important for people who may be dependent upon some type of electrical equipment for their health.
Great, thank you. And so I'll ask one more question and then one more quick informational question after that. We have a lot of people asking about NYCHA, so I just want to make it a little bit more broad so we can get a lot of these questions in there. What is the city thinking about, particularly when it comes to NYCHA and folks living in NYCHA for heat this summer?
NYCHA residents are absolutely eligible for the Get Cool NYC program. As I said, if they're above 60 years old or are reliant on medical equipment that limits their mobility. And so we are also reaching out to, NYCHA is reaching out to NYCHA residents to install air conditioners for residents who don't already have them and meet that criteria.
I would also add that for the first time this year, the city petitioned the state office that administers the Home Energy Assistance Program, and that office has expanded the criteria so that individuals who are living in public housing or receive other housing subsidies can apply for the cooling assistance program. So that, I think that's something that was not available previously. And, the Get Cool program is great, but if there are people who don't meet those criteria but have medical issues, they can also apply for HEAP.
Yeah, and we'll also add to that I believe they waive the requirement that you have to have medical documentation for this year as well. So please, everyone, the link is in the chat again for applying for HEAP. And then, so the last quick question before we thank our panelists is we have a lot of people asking about the cooling center map. Is that map yet open? Are the locations of the cooling centers publicized yet?
So the cooling center map will be open when there is a heat activation. So the city activates cooling centers for a forecast high of 95 degrees or a forecast heat index of 100 degrees. And these are thresholds that are guided by the health department and help to set by the health department. So we have cooling centers in all 5 boroughs, and when we are activating our cooling centers, you will see the cooling center finder up and running. It's at nyc.gov/beat the heat, or you can call 311. And not all cooling centers are open at the same time. Some are sometimes down for maintenance. This summer, some of our facilities that are usually used as cooling centers are not running. So it's really important that you check which cooling centers are open before you go out to a cooling center. And sometimes they change day to day, so please check every day, either by calling 311 or going to nyc.gov/beat the heat.
Great, thank you, Jamie. So everyone, keep an eye out for that map when there's a heat emergency called. So I want to thank our panelists. I know we didn't have enough time to answer all the questions. I appreciate our audience asking so many questions and being so engaged, which is wonderful. We'll work to get as many of these answered as we can after the meeting and send them around. But I want to thank our panelists so much for coming today and giving us all of this amazing information. So thank you.